you want to make sure that you keep your, well, you want to make sure you have the right balance. So if your hamstrings are really, really flexible and your quads are really tight, you know, that's no good. If your quads are really flexible and your hamstrings are really tight, that's no good either. You want to make sure that everything is moderately flexible enough so that everything is in balance, your strength is balanced, and your flexibility. Some of the things that you need to make sure so that you don't set yourself up for knee pain is that you rotate your shoes often enough. You have to have the right shoe for your running style, for your foot, for your arch. If you have very bad foot mechanics, you may want to consult someone for some orthotics to put in, some custom-made orthotics. I know I'm not the running coach. I don't really like that barefoot running hole thing. That's kind of, I don't know. Did you talk about that or?
No, I don't.
All right, so I'm not a fan, but I don't know. Anyway. It's just the way it goes. Okay, and as far as biking, you know, you want to make sure that you're spinning, you're not grinding, a nice circular pedal stroke. Make sure that your bike fit is right. And, you know, if you are pedaling the right way, but your bike fits incorrect, whether your seat is too low, if your cleat is in the wrong spot on your shoe, even if you're pedaling right for a lot of miles, you're going to end up with some irritated knees. So, bike fit. Very important. Some things I do with a lot of my patients and athletes is people tend to be one leg dominant, more dominant than the other. Make sure you do a lot of single leg training. If it's on an unstable surface or not, either way, you just want to make sure that you get smart with that one leg at a time. Single leg balance activities, single leg cable column work, single leg on a tilt board or on the BOSU ball, whatever it is that you have access to, I advise that you use it. When you're doing some indoor cycling, make sure you throw in some single leg pedaling, and try to get your cadence nice and smooth, and the pedal stroke really good. As far as weight training goes for your legs, I like closed chain activities. I don't like any of the open chains, seated leg extension. It's not functional. It's too much stress on the knee joint. But weight training is definitely important, as is stretching. So we talked about stretching your quads earlier. Stretching your hip flexor and stretching your quads is really important. When you're cycling, you go through so many repetitions of hip flexion. When you're sitting, your hip is flexed. I don't know if you guys realize this, but your psoas muscle, which is your main hip flexor muscle, attaches the anterior portions of the lower lumbar vertebrae, right, Rory? My more recent and autonomy physical therapy student, yes. Courses through the pelvis actually and attaches proximally on the femur. That is really important to get stretched out. I showed you guys a half kneeling psoas stretch. I think that you guys should do it after every long ride. You're bent over on your aero bars and you're flexing your hip, and there's no way that that's not going to get tight. Abdominal exercises, raising them over the legs, I think are a bad idea. Yes, you use your abs a little bit to stabilize, but mainly what you're using are your hip flexors. No one has weak hip flexors, I promise you. So you don't need to do them. These things too. I mean, you get a little abs, but you're really getting a lot of hip flexor. It's already a really thick, strong muscle. That can contribute to lower back pain and knee pain. So stretch them all the time. And make sure your bike fits just right. All right. Questions about knees? You know, yeah.
Sorry, the closed chain and open chain.
Oh, okay.
Because I've had, like, my knee problems I've been doing from like high school, like 1 year on, 1 year off. Luckily the past 3 years I've been fine. But I think I can attribute it to doing like leg extensions, but focusing on quadriceps. So what would you suggest for quad?
Well, we do a lot of things, you know. We do some like really nice clean bodyweight squats, step back into a lunge. I talked about how much I prefer stepping back into a lunge, much over stepping forward into a lunge. As long as you're lunging, I mean, you can pick your directions, you might as well go back. It's a much better way to do it. You can control your position better. It's better on your knee. Step up is a really great exercise to do. You could do any of these exercises with weight, holding a cable column. It's much more functional than those, you know, leg lifts and knee extensions. I mean, we have a machine here. But, you know, I pick and choose who I use it for. You know, I don't use it for that many people. But
I don't speak anatomy, but I mean, I've kind of heard that, like, in terms of imbalance of musculature and quad, maybe you can, like, pull the kneecap over
it's true.
to the
Yep.
side. Okay, so
It's true because it's floating. Like I talked about, some people have a smaller patella than others. The other difference is that some people may have like a deeper groove in their femur or flatter undersurface of the patella. And if your ITB is tight, which is going to come down laterally, it is going to pull your tracking a little bit to the side. Yeah, are you raising your hands? So, you know, we do try to correct those imbalances and strengthen like the longer adductor muscles, which counterbalance that lateral muscle. You have short adductors, that those muscles will pull you together, and you have long adductors which cross the knee joint. So the short adductors won't really change that tracking problem, but the long adductors really will. So, that
you
makes
really
sense.
only figure that out by doing, like, certain tests. Maybe, like, you.
Right. Right, and you know, visual inspection, we watch people move, and we watch people walk, and that really tells a lot, tells us a lot. Any questions about that? I have actually a poster with all the muscles on it if you guys want to like see, because when you see it, like for me, you know, like, with a really good understanding of anatomy and movement and movements in sports, you can break it down, you can figure out what it is that you want to make stronger to correct any kind of bad tracking, bad movement patterns, you know, whether it's upper extremity motion and watching how the scapula glides, or watching the kneecap as someone is doing a step up or step down or whatever it is, and then we try to make that balance better. It takes time. You know, people come in like 2 weeks later and they're like, I feel the same. It's like, well, it takes time, you know, it takes time to take the time to get there, it's going to take the time to get you better. Any other questions before I move on?